The treatment packs must be used in the strict number order, with the lowest available number first. Please use all packs in one box before starting a new box. Before using, please check that the ampules in both dose packs are intact. There are several pre-printed peelable labels in the treatment pack. Write the date of randomization on the labels for entry and outcome forms and attach the labels to the forms. Complete the details on the label post-discharge requirement and attach it to the post-discharge information form. Finally, write the randomization date on the label called Medical Records Cover and attach it to the front of the patient's notes to show that the woman has been included in the trial. All treatments must be prescribed. Dose 1 should be given to all randomized women and administered by intravenous injection at an approximate rate of 1 ml per minute as soon as possible after randomization. To confirm that the treatment has been given, use the labels provided to record this. If bleeding stops, there is no need to give the second dose. The second dose may be given if after 30 minutes bleeding continues, or if it stops and restarts within the 24 hours after the first dose. When the woman is discharged, she should be given a patient card and advised to carry it with her for 6 weeks. At discharge, death, or at 42 days, whichever earlier, the outcome form should be completed from patient notes. If at any time during the 6 weeks following randomization, the woman is readmitted to hospital, she should show the card so that the principal investigator can be notified. Most untoward medical events which happen in hospital are captured on the outcome form. If you want to report an event not on the outcome form, or if any untoward event occurs after discharge, you'll need to complete an adverse event form. You should identify a person responsible for the data collection and submission. You can enter the data from the entry and outcome forms directly into the trial database. You can also complete electronic entry and outcome forms and either upload them via the collaborator's intranet or send them by email as password-protected attachments. As a last resort, forms can also be faxed to the coordinating centre. Guidance on how to complete the forms and how to send the data is included in the study file. For online data entry, each person needs an individual username and password available from the coordinating centre. Please familiarise yourself with the contents of the investigator's study file and pay attention to the guidance sheet in front of the folder. Certain logs need to be kept up to date throughout the trial, such as the delegation log, randomization log, and drug accountability log. All patients consented for the trial but not randomized must be recorded on the screening log. All completed entry forms, outcome forms, adverse event forms, and signed consent forms must be filed in the appropriate sections. We will send you new storage files as the trial progresses. All trial documentation needs to be archived at your hospital for at least 5 years after the end of the trial. There is a secure intranet site for the trial collaborators. Access is by a username and password, which are available by emailing woman.data@lshtm.ac.uk. Via the intranet, you can upload the electronic entry and outcome forms, complete GCP training, and download training presentations. Also, patient information sheets in the languages spoken in your country are available on the intranet. If you need further information about any of the trial procedures, please contact the Trial Coordinating Centre. If you need advice about reporting an adverse event or unblinding a patient, you can call a 24-hour emergency telephone number. Regular updates are available on the trial website www.womantrial.lshtm.ac.uk. The success of the trial will be dependent entirely on the collaboration of midwives, nurses and doctors in the participating hospitals and those who hold key responsibility for the trial. The team at the Coordinating Centre are here to help you with any trial-related matters and will keep in contact with you throughout the trial with regular updates.